Nursing 431, Data Collection Methods. This first slide has our course learning outcomes, which I already read in the last PowerPoint. The next slide has your weekly learning outcomes. Again, I provided them during the PowerPoint for Chapter 12. Questionnaires are extremely important in nursing research and may be the only method of obtaining data related to certain human responses. They may be used to measure knowledge levels, opinions, attitudes, beliefs, ideas, feelings, perceptions, and factual information about respondents. A questionnaire is a paper and pencil self-report instrument. It contains questions that respondents are asked to answer in writing. The development of a reliable and valid questionnaire is a difficult task. There are many available literature resources for use in construction of questionnaires. Questionnaires can be used to measure knowledge levels, like I said, opinions, attitudes, beliefs, ideas, feelings, and perceptions, as well as to gather other factual information about the respondents. The validity of the data obtained through this method is governed by the respondent's willingness or ability to provide accurate information. A questionnaire should have an overall neat, attractive appearance. The length should be minimized to encourage people to respond. The content should be grammatically correct and contain no typing or spelling errors. Margins and spacing should be carefully considered. For duplication, a high-quality printing process and paper is encouraged. A questionnaire should be written in the respondent's preferred language and should be appropriate for the knowledge and reading level of the least educated respondents. Slang expressions and medical or nursing jargon should be avoided. There are many formulas that can be used to determine the reading level of various printed material. These include the Flesch reading ease, the FOG, the Flesch Kincard grade level, and the SMOG, which is simple measure of gobbledygook. Short questionnaires are likely to be returned than long ones. It is best to limit the required completion time to 10 minutes or less. The questionnaire should not be longer than 2 or 3 pages. Questions should be cut as short as possible. A desirable length for a question is fewer than 20 words. A question may need to be divided into questions if the length becomes excessive, or the question asks the respondent to consider more than one idea at a time. The actual wording of individual questions is important. Some general guidelines should be considered. Questions should be stated in the affirmative rather than negative manner. Ambiguous questions are those containing words that have more than one meaning or can be interpreted differently by various people should be avoided. Other types of questions to avoid include double negative questions, any question that implies the type of answer to be given, and double-barreled questions. There are many ways to categorize questions. Some of the most common forms of questions include demographic questions, open and closed-ended questions, contingency questions, and filler questions. Demographic questions gather data on characteristics of the sample. These characteristics, sometimes called demographic variables or attribute variables, include age, educational background, and religious affiliation. Closed-ended questions are the most structured questions. With closed-ended questions, the respondents are asked to choose from given alternatives. There may be only 2 alternatives, as in true/false questions, or there may be many, as in a checklist type of question in which the respondents are asked to check all items that apply to them. Other types of closed-ended questions include multiple choice questions and matching questions. Open-ended questions require the respondents to complete questions in their own words. Essay and fill-in-the-blank are types of open-ended questions. Contingency questions are those that are relevant for some respondents and not for others. The determination of whether respondents should answer certain questions is dependent or contingent on their answers to the other questions. Filler questions are items in which the researcher has no direct interest but are included in the questionnaire to reduce the emphasis on the specific purpose of the other question. You should group all questions about a certain topic together, especially demographic questions. A cover letter should accompany all mailed questionnaires. It may be the single most important factor in motivating respondents to complete the questionnaire. It should be brief and contain the following information: the identification of the researcher and any sponsoring agency or person, the purpose of the research, how the participant was selected, the reason the respondent should answer the questionnaire, the length of the time required to complete the questionnaire, how data will be used or made public, the deadline for the return of the questionnaire, an offer to inform the respondent of the results of the study, the researcher's contact phone number, address or email address, and the personal signature of the researcher. Information on how to complete the questionnaire must be clear and concise. If several different types of questions are included on the instrument, it is helpful to provide the respondent with an example of the appropriate way to respond to a particular type of question. There are many methods of distributing questionnaires. They may be given to potential respondents in person, placed in a convenient location where potential respondents can take one, or they may be distributed through a mailing system such as the U.S. Postal Service or a hospital interdepartmental mailing system, or made available through the internet. Several factors seem to positively influence response rates of mailed questionnaires. These include mailing them at a time other than the holiday season or popular vacation times, hand-addressed outer envelope, the personal signature of the researcher on the cover letter, motivational information in the cover letter providing an incentive such as a small cash payment, the neatness and clarity of the instrument, the ease of completion of the instrument, the time required to complete the instrument, a guarantee of anonymity, and the inclusion of pre-addressed stamped envelope. There are several advantages to using questionnaires in nursing research. Questionnaires are quick and generally inexpensive means of obtaining data from a large number of respondents. They are one of the easiest research instruments to test for reliability and validity, and their administration is less time-consuming than interviews or observation research. Using questionnaires allows data to be obtained from respondents in widespread geographical areas. Questionnaire respondents can remain anonymous, and when they remain anonymous, respondents are more likely to provide honest answers. There are also some disadvantages to using questionnaires in nursing research. Disadvantages include cost and the danger of a low response rate. With questionnaires, respondents may provide socially acceptable answers or may fail to answer some of the items. Respondents may not be representative of the population. Because questionnaires are self-administered, there's no opportunity to clarify items that may be misunderstood by respondents. Other disadvantages are the respondents must be literate and have no physical handicap that would deter them from completing the questionnaire. Another method is an interview. An interview is a method of data collection in which an interviewer obtains responses from a subject in a face-to-face encounter through a telephone call or an internet connection. Interviews can be used in quantitative and qualitative studies. Interviews are used to obtain factual data about people as well to measure their opinions, attitudes, and beliefs about certain topics. Data obtained in interviews are usually recorded on an instrument referred to as an interview schedule. An interview schedule contains a set of questions to be asked by the interviewer. It may be structured or unstructured in format. Respondents' answers may be entered directly on the interview schedule or recorded on a separate coding sheet. Data obtained from an interview may also be recorded on audio tape or videotape. The training of the interviewer is the responsibility of the study's investigator. Interview training should be rigorous. The investigator should continue to work closely with the interviewers throughout the course of the study. The training should be carried out in groups so that all interviewers receive the same instructions. During the training sessions, the researcher should provide interviewers with a description of the study and its purpose. General procedures are discussed, and the interview schedule is reviewed in detail. The purpose of each question is pointed out, and the meanings of all words clarified. The process of recording information must be explicitly communicated. Special attention should be given to the use of probes, and any variations that will be allowed in the interview process should be discussed. Interviews can be categorized as unstructured, structured, or semi-structured. In unstructured interviews, the interviewer has freedom to direct the course of the interview. Structured interviews are conducted more like usual conversation, and topics are pursued at the discretion of the interviewer. Unstructured interviews are frequently used in exploratory or qualitative research study. The interviewer may start the interview with a broad opening statement, such as, "Tell me what it was like for you after your husband had his heart attack." Depending on the response to this opening question, further questions are formulated. Probes may also be used. Probes are additional prompting questions that encourage the respondent to elaborate on the topic that is being discussed. When accurate comparisons between subjects are not critical, unstructured interviews will produce more in-depth information on subjects' beliefs and attitudes than can be obtained through any other data gathering procedure. Structured interviews involve asking the same questions in the same order, in the same manner of all the respondents in the study. This type of interview produces data that can be compared across the respondents. Interviewers must try to remain very objective during the interview and avoid unnecessary interactions with respondents. In the semi-structured interview, interviewers ask a certain number of specific questions, but additional probes are allowed or even encouraged. Both closed-ended and open-ended questions are included in a semi-structured interview. In this type of interview, data are gathered that can be compared across all respondents of the study. There are 3 phases of the interview. The phases are before the interview, during the interview, and after the interview. Guidelines for the interviewer are important in each phase. Before the interview is conducted, the interviewer should introduce herself or himself. The purpose of the study should be explained. Potential participants should be told how they were chosen, how the obtained information will be used, and each person should be told how long the interview will last. During the interview, the interviewer should ensure a private, comfortable interview atmosphere. Participants should be made comfortable and unnecessary noises should be controlled. The interviewer should use language that is clearly understood and talk in a conversational tone. Participants should be informed that there are no right or wrong answers. No pressure should be applied for answers. Questions that are of sensitive nature should be left until the end of the interview when rapport may be more fully established. And lastly, the last phase, after the interview, the interview has been concluded, participants should be asked if they have any questions. Further explanations of the study can be made at this time. Interviewers should thank the participants for their contribution to the study, provide compensation if appropriate, and indicate how study participants may obtain the results of the study. In face-to-face interviews, I should have moved on. In face-to-face interviews, the interviewer may have a great deal of influence on the outcome. In non-experimental research, this phenomenon is referred to as the Rosenthal effect. In experimental studies, it is referred to as the experimental effect. Certain interviewer characteristics such as ethnic background, age, gender, manner of speaking, and clothing influence the answers provided by the respondents in face-to-face interviews. Interviewers should be neat in appearance, courteous, friendly, and relaxed. Flashy jewelry should be avoided, as well as any item that would identify the interviewer with a specific social group or organization. It is desirable for interviewers to possess similar demographic characteristics and dressing styles as the respondents. In telephone interviews, the interviewer's verbal mannerisms such as tone of voice and dialect may be a positive or negative factor in soliciting cooperation from the respondents. The interview method has many advantages. The advantages include a high response rate, in-depth responses from a wide range of participants, a high percentage of usable data, and the ability to observe verbal and nonverbal behavior during the interview. The interview method also has several disadvantages. Conducting interviews can be time-consuming and expensive, and arrangements for interviews may be difficult to make. Because the interviewer is present, participants may be influenced by the interviewer's characteristics or may intentionally provide socially acceptable responses. Participants may also be anxious because their answers are being recorded. The semantic differential scale allows subjects to indicate their position or attitude about concept along a continuum between two adjectives and phrases that are presented in relation to the concept being measured. The number of positions on the continuum varies from 5 to 9, with 7 being used most commonly. Scores are then calculated for all subjects. Researchers have devised many methods to assess the personality characteristics of people. Personality inventories and projective techniques are two of these methods. Personality inventories are self-report measures used to assess the differences in personality traits, needs, or values of people. These inventories seek information about a person by asking questions or requesting responses to statements that are presented. Scores are often then derived for each person for the trait being measured. Some of the more commonly used personality inventories are the Minnesota Multiphasic Personality Inventory, the MMPI, the Edwards Personal Preference Schedule, EPPS, and the 16 Personality Factor Questionnaire, which is 16PF. Using various projective techniques, a subject is presented with stimuli that are designed to be ambiguous or to have no definite meaning. The person is often asked to describe the stimuli or to tell what the stimuli appear to represent. The responses are believed to reflect the internal feelings of the subject that are projected into the external stimuli. Example of this test, I'm sure you remember, is the INC test or the TAT test. The Q sort or the Q methodology is a means of obtaining data in which subjects sort statements into categories to their attitudes toward or rating of the statements. Participants are presented with a number of words or statements that are written on cards or pieces of paper. The number of cards or papers to be placed in each category or pile by the subjects is predetermined by the researcher. The forced choice arrangement usually calls for piles to be distributed in the form of a bell-shaped curve. The Delphi technique is used to describe a data collection method that employs several rounds of questions to seek a consensus on a particular topic from a group of experts. The purpose of this method is to obtain group consensus from a panel of experts without bringing this group together in a face-to-face meeting. A visual analog scale presents subjects with a straight line drawn on a piece of paper. The line is anchored on each end by words or short phrases that represent the extremes of some phenomenon such as pain. Subjects are asked to mark on the line at the point that corresponds to their experience of the phenomenon. Frequently, the line is 100 mm in length, which simulates a 0 to 100 rating scale. Pre-existing data involves the use of existing information for research that has not been collected for research purposes. Some sources of existing data include patient charts, records from agencies and organizations, such as hospitals, the U.S. government, local public health departments, churches, licensing bureaus, and professional organizations. Personal documents such as diaries and letters may be examined as well as almanacs and professional journals. Observational research is concerned with gathering data through visual observation. For observations to be considered scientific research, a carefully planned study is necessary. The researcher must decide what behaviors will be observed, who will observe the behaviors, what observational procedure will be used, and what type of relationship will exist between the observer and the subjects. The research question or study hypothesis determines the behaviors that will be observed. Psychomotor skills, personal habits, and nonverbal communication patterns are examples of behaviors that can be observed. Since human error may occur in visual observations, it is preferable to have more than one observer in a study. Estimates of data reliability can be made. Inter-rater reliability is the degree to which two or more raters or observers assign the same rating or score to an observation. Observations may range from very structured to very unstructured. Structured observations are carried out when the researcher has prior knowledge about the phenomenon of interest. The data collection tool is usually some kind of checklist. The expected behaviors of interest are identified on the checklist. The observer indicates the frequency of occurrence of these behaviors. In unstructured observation, the researcher attempts to describe events or behaviors as they occur. With no preconceived ideas of what will be seen, this requires a high degree of concentration and attention by the observer. A combination of structured and unstructured observations is often used in nursing research. The observation guide or instrument may be designed with some preconceived categories identified, but it also allows the observer to record additional behaviors that may occur. This combination of structured and unstructured observation provides quantitative and qualitative types of data. Observation research may be classified as either event sampling or time sampling. Event sampling involves observation of an entire event. Time sampling involves observations of events or behaviors during certain specified times. Physiological measures involve the collection of physical data from subjects. These types of measures are generally more objective and accurate than with many of the other data collection methods. Another advantage of physiological measures is their precision and accuracy. One of the greatest disadvantages is that special expertise may be necessary to use some of these devices. Attitude scales are self-report data collection instruments that ask respondents to report their attitudes or feelings. The most commonly used attitude scales are the Likert scale and the semantic differential scale. The Likert scale usually contains 5 or 7 responses for each item, ranging from strongly agree to disagree. Data from a Likert scale are generally reported at ordinal level of measurement. Therefore, some statistical tests may be performed. The specific data collection methods used in a published report should be carefully critiqued. Read the entire research report in order to determine whether or not the appropriate design has been used. Sufficient information should be provided to allow the reader to determine if the data collection method was appropriate for use in the study. If not familiar with data collection methods mentioned in research articles, it is advisable to consult a research textbook to learn more about the methods. In order to critique data collection methods, you need to read the entire research report, try to tell if the best data were obtained from the method, and consult textbooks if you're not familiar with the methods used.